So an explanation of chiropractic, I like to look at this anatomical chart, and I like to first recognize that when God made the human body, He put one organ inside of the head that's in charge of all the other organs. Obviously that's the brain. So in order for your heart to beat, or your lungs to breathe, or your stomach to digest food, to heal a cut on your leg, to fight off cancer, or to beat infections, God's power and information, really its life, has to flow from your brain down this life hose called a spinal cord, down smaller life hoses that are called nerves, to every single cell in your body. So I usually ask the patient, I'm like, in order for you to heal and be healthy, what percentage of these nerve messages do you want going to your body? And they usually say 100%. And I say, well, how about for your spouse? And they say 100%. So how about for your kids? And they say 100%. I say, okay, so then everybody should be checked, their spine, and they're like, yeah. So that gets that out of the way. Then I ask them a couple simple questions, and I say, if the signals from the brain going down this life hose, going to the heart, if we took a pair of scissors and cut them in half, what would happen to the heart? Then they would say the heart would stop beating. And I would say, well, then what would happen to the person? They say they would die. I said, correct. And I said, when God made the human body, He protected the skull. He protected the brain with a skull, which is a hard bone. And He protected this life hose with 24 movable bones called vertebrae. Just like in this model right here. Inside of here is the vertebrae. This person's facing that way. I'm sorry, inside of here is the spinal cord. This is the spinal nerve. And Chris, if you put your pinky finger in there, actually right here,
oh, yeah.
and then tell me when you start to feel the pinch.
Yep.
Pinch?
Yep.
Right, so
Wow.
somebody that's chronically, leaning over on the computer or it's an occupational repetitive micro trauma or recreational, could potentially damage their nerves or at least interfere with the signals coming from the brain going to that body. So if this person right here, for instance, was bent forward all the time on their cell phone and these bones strangulated the spinal cord, could it affect the way the heart beats? Absolutely. It could be high blood pressure, low blood pressure, fast heartbeat, slow heartbeat, sinus arrhythmia, cardiac pulmonary disease. And what happens, we're taught that when we have symptoms like that, we're supposed to go to that specialist, a heart doctor, and they'll run in to test. Now, normally when you go to a cardiologist for high blood pressure or low blood pressure or something like that, they don't send you to a chiropractor. They send you to a heart specialist. Yeah. And chances are, after you go through a certain amount of tests, you're going to leave with some medicine. And then absolutely 100% that medicine will have side effects. And then it leads into that spiral. They say that the leading cause of death in the United States of America is cancer. The second leading cause of death is heart disease. The third leading cause of death is medicine. Properly prescribed medicine with side effects and non-properly prescribed medicine with side effects. So moving forward, on this chart right here, this has the neck, the back, and the low back. So what we call this here, when one of these vertebrae are out of alignment in comparison to 3 above and 3 below, we call that a subluxation. A subluxation is a misalignment of a vertebrae in comparison to the other ones. Sub meaning less, lux meaning life, ation meaning expression, less life expression. If there's a misalignment right here in the back, the signals going to the heart are lessened, and then the heart could act erratic. It could act hyperactive or hypoactive. Somebody with asthma, for instance, coming back to this chart, in the neck, if there was a subluxation and the signals from the brain weren't properly getting to the eyes, ears, nose, throat, and stuff like that, the person could have symptoms like headaches, migraine headaches, dizziness, sinus problems, allergies, head colds, fatigue, visual problems, runny nose. Most of that stuff we were never taught to go to a chiropractor before. But if you Google allergies and chiropractic, a plethora of articles are going to come up and talk about the success of how somebody had seasonal allergies or allergies, and then they went to the chiropractor and they found a subluxation, they started getting adjusted, and they don't have allergies anymore. Are there those cases where somebody goes with allergies to a chiropractor and the allergies don't go away? Yeah, absolutely. But I mean, you figure a non-medicine or surgical procedure way to get rid of allergies, why not? And the cost is so low. If there was a subluxation in the middle of the back and the signals weren't properly getting to the heart and lungs, then the person could have congestion, difficulty breathing, asthma, high blood pressure, heart conditions, bronchitis, pneumonia, gallbladder. If it was in the low back and the person signals weren't properly getting to the intestines and the reproductive organs, they could have constipation, colitis, diarrhea, gas pain, irritable bowel syndrome, bladder problems, women, menstrual problems. It could be pain and tingling in the low back. One thing I want to point out that it's interesting to everybody, all the nerves that come out of the low back, which are the lumbar, and the nerves that come out of the sacrum, once they exit the spine, they all come back together and form into a big rope. This rope is the largest nerve in the body, and it's called the sciatic nerve. And then it bifurcates. In other words, it splits into two. And half of it goes down the back of the leg, and the other half goes down the front of the leg. The tibial division is in the front, and the common peroneal division is in the back. The reason I bring this up is because whenever anybody has symptoms below the waist, numbness, tingling, burning, aching, atrophy, or something like that, they call it sciatica, which basically only means that it deals with the sciatic division. Nice. And subluxations are a big cause of that. Another thing that I'd like to point out is I'm not in charge and I don't do the healing. In this office, I don't know about other offices, but I know that God's in charge. And it's not necessarily a religious play, but God is in charge and God does the healing. So I never, ever, ever, ever healed anybody in my office. The only thing that I do is I check them for subluxations. And when I find the misalignment, I gently put the bone back in place. I can use force with my hands. As you gentlemen saw today, it could be real light touch on the spine, or I can use instruments. Once I put that person back into a proper position and the life hose, the spinal cord, is unkinked, life is restored back to the physical, and it works. It's like, think about a garden hose, and there's tomatoes, cucumbers, and eggplants in the garden. And if the hose is kinked, no matter what, those organs aren't going to grow. And if the medical profession comes in and puts quick grow on there or fertilizer, without water, they're going to burn out the plants. They're going to have adverse effects. But the point is that if you unkink the garden hose, the tomatoes and the vegetables are going to grow. You don't have to worry about it. Same thing in the human body. If that spinal cord is being interfered with, or if the brain stem has tension on it, the messages from the brain are distorted and the body will act erratic. So what we say as chiropractors, before you take medicine or before you get a surgery or before you get into these heavy procedures, go get your spine checked. And if there's misalignments in there, nice and gently we move the bone. How we find subluxations is this is a instrument right here. This is a diagnostic infrared imaging test, and it's not that expensive, to start. For somebody that's thinking about chiropractic, truthfully, you can start your own office for about $500. You buy a chiropractic table, you can get a used one, you maybe sublet an office with somebody, and you get some pamphlets or something, and you go out and you start setting up your office. When you build up a nice clientele, then you can get into another office. So it doesn't take that much to start. And you really don't have to work with somebody unless you want to, you can. So this instrument, it's not that expensive, but what it does is it registers heat. And this is one way to find out an indication if somebody has subluxation. The average body temperature is 98.6 degrees. We run this right on back of the neck. And if the person's neutral, normal, you'll see all white bars on either side of the neck. If they have some erratic activity, if they're slightly irritated, normally irritation produces heat. That's why we tell somebody when they have an acute injury, put on ice and not heat. So this person right here had an abnormal scan. They were complaining of low back pain. Here's that word again, right sciatica, which are nasty things that go into the leg. And they were fatigued. In other words, they were always tired. Interestingly enough, this person right here came into our office and they didn't have any symptoms, but their graph was so abnormal. So in starting to question the patient, we found out that they were on diabetes medicine and high blood pressure medicine. So for a person to be on that much medication, the body's not functioning 100% or normal to need that much help. So then after we do this, that'll give us a pretty good indication of what the person's expressing. Then we'll take them into the next room over here, and we are one of the only chiropractors in the area. We have digital images. again, for students that are thinking about chiropractic, you don't even need an x-ray machine. You can just basically send the person out and they can go to the local, radiology place and get their pictures taken and then bring them back to you and you could read them. In this office, we happen to have digital x-rays, so it comes right up and we get to see them. And then, so then we'll be able to look and we'll see if the person has subluxation. If the person's a little older and they're in a lot of pain, chances are they might have some decay, or potentially they might have some fusion. That would be really bad. Then the last thing that we do is we lie them comfortably down on a table, obviously after checking their posture, and we do what's called a nerve pressure test, and we go over each and every vertebrae to find out with your hands, to find out if there's any heat there with your hands, or if there's muscle spasm, or if the vertebrae is not moving, or when you're pushing on that particular vertebrae, if the patient's saying ouch. And that's pretty good. Then what happens is the patient leaves, and then they come back for their second visit, and as you saw just a couple of minutes ago, I do an x-ray report and draw different lines on there. I'd like to make it real easy for the patient to read the x-rays because I want them to feel comfortable. And I want them to know how to heal themselves and, how to get into a good place. It's like, you want to know how to align your car, because if you don't, the car is going to break down. So then after that, they come back and we give them a care plan. The last thing I want to say is, how do you get a subluxation? Well, subluxation happens from three things. From physical stress, which could be, on your cell phone like this, or being in a car accident, or sleeping on the couch the wrong way, or always carrying your book bag a certain way, or carrying your briefcase on one arm all the time. That's a physical stress. The next one is an emotional stress. Emotional stress could be in a job that you really don't like, or for a kid it could be they're having like an 8-year-old birthday party and then it rains, or it could be for parents, helping their parents die, with the sickness and the end of their life. Or just, anything emotional. So physical stress and emotional stress. And the last one is chemical stress. Chemical stress is, a lot of people don't think about it, but sometimes when we diet and we deprive ourselves of carbohydrates and sugars, that can stress out the body. Or if we're splurging and we're having a great meal or something, too many carbohydrates and sugars could hurt the body. Also, as I said earlier, properly prescribed medicines will cause side effects. That's a chemical stress. And obviously alcohol and marijuana and different recreational things like that could cause chemical stress. So for a student that's thinking about chiropractic, it's like your boss is God. Your co-pilot's God, because you're taking his framework and you're adjusting the person, and then you let them stand up and enjoy themselves for the rest of the day. And then you have them come back until they're in a proper position, and then you start reducing their symptoms. Whatever you think you want your fee to be. Right now, a nice cash fee is around, $35 to $65 for an adjustment. And then however many people you want to adjust a day. Let's say if you're averaging $40 a visit, and you adjust 30 people a day, it's $1,200 a day. And you want to work 4 days a week, it's $4,800 a week in the beginning. You try to keep your overhead low. If you're working with one room, and you're subletting, a student can make a ton of money. But the thing of it is, the truth of the matter is I never worry about the money, because my main goal, my passion is to help people. And people that are in physical therapy in their first couple of years, and they don't think it's something, they're just not down with it anymore. It's too mechanical or mechanistic. It's nice because you could take your physical therapy credits and you can use them towards your chiropractic degree, so it's like there's no lost time. So it's like, what you've gained, you're not losing, and you can turn that into that. But for me, chiropractic's been an endless vacation. It's just been so, I'm just so blessed. Every day I come to the office, and it looks like I'm doing the same thing over and over and over again. But the truth of the matter is you're dealing with a new mommy, or a new daddy, or a new child. And every time you lay hands on somebody, you know that they're better when they stand up. And for that, it's almost like to come to work and have that much joy and to get paid for it is like an incredible bonus. So anybody that ever wants to come to my office and talk to me about a career in chiropractic, I'm kind of partial to a couple schools. One's in Spartansburg, South Carolina, and one's in Atlanta, Georgia. So that's about it. This is Dr. Dave, October 10th, 2018, 6:50, with the guys of the future. That's a wrap.